Welcome to New Detroit's Town Hall, Content and Conversations on Race. I am Marshall Favors, Program Manager for New Detroit. New Detroit is a nonprofit organization that works to eliminate racism and create a more just society in metropolitan Detroit. To learn more about us, you can visit us at newdetroit.org. I am so excited about today's town hall. Our topic is advancing a racial equitable COVID-19 recovery. And this is the first of a three-part town hall series based on a report we commissioned from the Brookings Institute with support from Rocket Community Fund. The report is called Examining and Addressing COVID-19 Racial Disparities in Detroit. We're going to have a Q&A. We want everyone to participate. So feel free to pose your questions using the chat feature on Zoom, or if you're joining us on Facebook, you can pose your question in the chat. Now, I get this distinct honor of introducing today's moderator. Kat Stafford is a nationally investigative writer focused on race and inequity at the Associated Press. She investigates how structural racism has fueled inequity in America through the lens of politics, governmental health, governmental justice, and more. We are pleased to have Kat Stafford as today's moderator. Welcome, Kat.
Thank you so much for that wonderful introduction, Marshall. And I have the honor of introducing our two very accomplished and distinguished guests on our panel. And I just want to say that I cannot think of a more important topic to be discussing right now than the disparate impact that COVID-19 has had on Black communities across the nation, including our very own right here in the city of Detroit. So first, I want to introduce Jane Fran Morgan, who is the president of JFM Consulting Group, which is a Detroit-based strategy, planning, and evaluation consulting firm. As founder of JFM with more than 20 years of experience, Morgan leads a dynamic team and works in partnership with diverse nonprofit, philanthropic, and public sector clients. Utilizing a participatory approach, Jane strives to engage stakeholders in meaningful ways, defining and measuring progress, effectiveness and impact, and identifying opportunities for improvement. Additionally, she is committed to helping local, state, and national organizations and institutions make informed, data-driven, and strategic decisions. Thank you so much for joining us today, Jane. I also want to introduce Dr. Rashawn Ray, who is a David M. Rubenstein Fellow in Government Studies at the Brookings Institute. He is also a professor of sociology and executive director of the Lab for Applied Social Science Research at the University of Maryland, College Park. Ray is one of the co-editors of Context magazine, Sociology for the Public. His research addresses the mechanisms that manufacture and maintain racial and social inequality, with a particular focus on police-civilian relations, racial health disparities, and voting. His work also speaks to ways that inequality may be attenuated through racial uplift activism and social policy. Thank you both for participating in this town hall conversation today. So let's just jump right in with the first question. So Jane, I'd like to start with you. You know, I've spent this past year really covering COVID and its disparate and really devastating toll that it's had across the nation. But like I said, it feels really acute here in my hometown of Detroit. So what ways do you think Detroit is a kind of unique case study when we're talking about the disproportionate impact on that COVID has had on Black communities as well as other communities of color?
Well, Detroit, I think, is a unique case study, and perhaps you could even say the perfect case study for this because of the very large Black population that Detroit has. And so we've seen here what happens on a large scale when you have a Black community that has been experiencing racial disparities. So what began as a public health issue very quickly morphed into something much larger and just really exploited all of the challenges and the weaknesses that were brought about as a result of these racial disparities. On the healthcare front, for example, where there were already issues concerning access to quality health care, so many in the Black community not having primary care physicians, many having to use the emergency room for their health care. Discomfort and distrust of the healthcare system, the very system that we would need to rely on to get through this. There were affordability issues, just myriad challenges just in terms of healthcare alone. And when you add to that all the layers that were touched as a result of COVID, housing, food access issue, transportation, it just multiplied it by a factor of 10 and just made everything that much worse. And so all of these issues existed in Detroit prior to COVID. They weren't new, but it really did exacerbate the problem for those who were already facing it. It created new problems for those who perhaps weren't facing it, because now you've got employment issues on top of this. So it was really, I'm not going to say the perfect storm, but it was just the worst combination of factors that you could probably have brought together at one time.
Absolutely. And Dr. Ray, so, I've had the pleasure of interviewing you a handful of times already, and even about this very report here. So in many ways, and I believe I've told you this before, it feels like Detroit in this report that you guys did was kind of a microcosm of what other communities of color, other Black communities are experiencing across the nation. So from a national perspective, can you talk about how Detroit's story kind of compares to what we are seeing across the nation right now?
Yeah, well, Kat, thank you for that question, and it's great to be on with you. As always, it's always great to see Jane, who's doing such amazing work in Detroit, in the area in Michigan. I mean, when we look at what happened with Detroit, Jane summed it up very, very well when she mentioned it was an unfortunate perfect storm, where essentially what COVID has done, and one of the things Jane, how she frames it, is that COVID-19 has these spillovers into other aspects of life that have not been addressed. And the state of Michigan has been one of the hardest hit states when it comes to COVID-19, not just including when it comes to racial disparities, but even more recently with the spikes that we saw across the state. And so we know that the state of Michigan and the city of Detroit in particular, relative to, say, New York City or the state of New York, New Jersey, and also other states like Alabama and Louisiana have been hit similarly. And there's one thing that all of these areas are plagued with, in addition to some others around the country that are predominantly Black working class cities, is that they've been hit extremely hard by COVID-19 racial disparities due to unaddressed structural conditions that undergird people's lives even when we're not in a pandemic. The things that Jane mentioned about limited, not only in terms of health insurance, but also limited access to healthcare. And then when they are able to get to a place where they get healthcare, which is oftentimes, say, in an emergency room in a hospital, then we know that there are issues even there in terms of the provider patient interaction with Black people. So you put all this together, and you have Black people in Detroit with such a long and prosperous history, but a more recent present that has been imbued with the remnants and the continued legacy of segregation and redlining, speaks to some of the inequities that we see, in addition to the headlines that people see about how much COVID is spiking and the fact that Black people are so much more likely to die from COVID than other racial groups. But it's also the fact that people's lives in housing, in healthcare, in education, in small businesses are also being fractured and hurt as well.
So I'd like to kind of take a step back, because I know this conversation, of course, is about racial disparities, but I do think it's important to kind of talk about what led us to this point where we are now experiencing these disparate disparities, right? So what role does structural racism, systemic racism, or in some facts, institutional racism play into what we are seeing today in Detroit, as well as communities across the nation? I will love both of you to answer this.
So I'll start, and then I'll let Rashawn follow up, and thanks for your comments there, Rashawn. Very important. So structural racism, I mean, everything is the short answer to that question, because it contributes to the the economic and financial instability that we see that drives so much of this, in terms of not only people not having the resources to afford healthcare insurance and get the kind of care that they need, but also, housing, the other issues that I brought up earlier that are all touched by this, places people in positions where they're having to work in jobs that don't allow them the kinds of protections that other people have. So many people not being able to have the luxury of working from home. I mean, it touches everything. And because it's structural, it has to be, unless it's addressed at a structural level, it's just going to continue. And we've seen this, decade after decade of this going on. And so that's why there needs to be a comprehensive structural approach to addressing it. Otherwise, this isn't going to be the last pandemic. There'll be another one at some point, and there will be again.
Yeah, I mean that's exactly right. I mean, one thing that I always say is that when America catches a cold, and of course we know this, it's a saying in the Black community that when America catches a cold, Black people get the flu. Well, what we've seen during the pandemic is that when America catches COVID, Black people are more likely to die. And as Jane is saying, they're just not more likely to die because we're Black or because of something related to genetics, which is what people try to say. It's because of structural conditions that undergird our lives. If we look at a person in the city of Detroit, just say trying to get to work on a normal day, the number of people who they might pass by if they're living in a densely populated area, the fact that social distancing, which is still something that people say should be happening, particularly if people have not been vaccinated or are inside, we know that Black people are more likely to be hit on those fronts. Not only has it been more difficult for certain people to gain access to the vaccine, which I've been describing as vaccine gerrymandering in a sense. And we know in Detroit, as we've heard from people, that there were people from other parts of the region coming to Detroit early on when the vaccine was available, and getting vaccines that were for people in Detroit. Of course, these people are disproportionately Black who these vaccines were for. And then also we can look at where people were able to get the vaccines at. If there were limited options, we saw that playing up. And even though we know there have been great work by churches and community organizations to do their part, we know that there were still inequities there. So a normal person leaving their home, which might be densely populated, where they're passing by a lot of people, commuting, for example, riding the bus. And then we know the types of jobs that Black people are more likely to be in are service-oriented jobs where you simply can't social distance, where you're interacting with people at a grocery store, at a restaurant, at a warehouse, at a factory. And these have been the hardest hit occupations. That when we simply look at COVID through the lens of occupations, we see that chefs, manufacturing workers, people who work in grocery areas have been more likely to die from COVID, just in an extremely higher rate. And we know that Black people as well as Latinos are more likely to work in those occupations. So we see it the way that we start our day and the way that we end our day. And then we haven't even got to education, which of course, thinking about keeping your kids at home to set them up with computers and all this technology and having Wi-Fi that doesn't go out every single day becomes something that's more challenging for others. And we saw this in the participants of the study, either the quantitative data or the qualitative data that we analyzed.
And so both of you have kind of already touched on what I'm about to ask, but a lot of the reporting that we have seen around COVID, of course, has focused on the health side of it, the health implications. But there's also been a lot of discussion in terms of what the pandemic has impacted outside of that. So can both of you kind of speak to the data around the effect that the pandemic has had on compounding existing racial disparities that exist beyond and outside of health, the health areas that we've seen being impacted?
So I'll just mention a couple. One we touched on already, just in terms of overall economic and financial instability, which undermines everything. So if you can't afford to, if you don't have the, if you aren't working, if you don't have the funds to support your children, your family, and you're going to really face challenges. So, and this happened for people who lost their jobs, put people in positions where some of them had to work. They were forced to make a choice of, going back into a situation that they didn't feel comfortable working in, but, what's the alternative? And so there was considerable economic instability that came about as a result of this, due to things shutting down. And Black people, again, were disproportionately impacted by that. Another area is small business. And while African Americans have outpaced other races in terms of opening businesses for the last several years, they are also the most vulnerable businesses. They're the most undercapitalized businesses. And they're, of course, the businesses in the case of a pandemic that would be the first to be hit by this. Couple that with structural racism that leads to limited access to the supports, to PPP, to the resources to help keep them afloat. It just creates a crisis that we don't fully understand where that's going to end up, the extent of that impact on the Black community yet.
Yeah, it's extremely unfortunate. I mean, when we look at it statistically, with the respondents in Detroit, Blacks were 3 times more likely than whites to report having challenges with getting food, getting water, other household supplies. They were also much more likely to talk about the cost of medications, also accessing those medications. And that becomes important for people to note, because if you're living in an area that isn't just a food desert. I think we use that term and that's been scaled up. People have a good sense of what that is. But what we've seen during COVID is essentially a healthcare desert, where it's not simply about getting to a doctor. And I mean, we haven't even got to talking about specialty physicians, but then being able to access medication and having to wait a series of days until that medication actually comes. That becomes extremely important to think about. And of course, I mean, some of the stats were just completely off the chart. So for example, when we talk about Black residents in Detroit compared to white residents, Black residents were 7 times more likely, and I should say are, because I mean, these things are continuing, are 7 times more likely to be concerned about being evicted and 17 times more likely to report needing rental assistance. So that's another thing when we talk about housing, where the moratorium on aiming to protect people when it comes to housing, to keep them in their apartments, is something that hasn't happened. Black people were over 40% more likely than whites to report running out of money. And that's important because over 75% of Detroiters that were in our study made under $50,000. So, I mean, these challenges in talking about housing and medication and food and water, household supplies, I mean, it's really, really something big, where we see Black people trying to gain access to more food banks. And then again, we haven't even discussed education, which is, I think, another essential need, particularly when you have young children, to try to ensure that they are still learning during a pandemic in a space where we know that there are also internet issues in a lot of areas, not only in terms of access to Wi-Fi, but also in terms of access to the equipment that people need to be able to continue their children's learning.
Those are,
And
oh, go ahead.
I just want to add one thing in terms of the educational challenges, and also just the environment. I mean, you don't necessarily have a room, a space where children can learn quietly. You don't have parents who are able to create these pods with other parents and trade off in terms of providing the supervision and the additional instruction for their children. It is a challenge that many families are not able to rise to, and then will be coming back into at some point when they're back in school, farther behind the 8 ball. So
That's an excellent point to make. And that's another think that we still not have seen enough discussion around. And to your earlier point, I think we have yet to truly realize the impact that this pandemic will really have on these communities that we're talking about right now. I just want to take a quick moment to say, for those who are watching, if you have questions, please post them in the chat here. If you are watching on Facebook, please post your questions that you have in the comment section there, because I do want to make sure we have a chance later on to ask both of our panelists these questions you might have. So I kind of want to go back to, Jane, you talked about Black businesses. And, you know, in the early days, you know, I did a story that was focused on Black businesses, kind of rooted actually out of Detroit. And one of the things I heard from a lot of these business owners was frustrations about access to the PPP loans. They also talked about this was nothing new, that they have had challenges in terms of trying to gain access to funding for decades, right, for a very long time in this country. And there's also a real concern that with these businesses potentially closing, or those who have already closed, that we are going to see a disruption in terms of the fabric of the very communities that we're talking about. So what would you say in terms of the impact has this pandemic had on Black-owned businesses? And do we yet know, again, truly the real impact that it's going to have?
So I mean, the jury's definitely still out. We don't know exactly what the impact is going to be. We know that Black businesses have always been vulnerable, more vulnerable than other businesses. And so this just created a situation that exacerbated that problem. When PPP came along, I think there was initially, at least, a sense of hope among Black businesses that, okay, the playing field is a bit more level now. Everyone understands that we're all having a problem here. And then the next thing you read that, you know, Harvard got money and Ruth's Chris Steakhouse got funding. And then you had a lot of small Black businesses that were locked out of the process. And, you know, round one money is gone, and oh, well, you know, hope you can make it. And that felt like par for the course for a lot of small Black-owned businesses. And some of them are, you know, were not able to survive. Couple that with the fact that Black-owned businesses tend to hire Black people disproportionately. And so they're, you know, for those that had employees, you know, those jobs are also gone. So I think we haven't seen yet what where the bottom is with this, but absent a deliberate and intentional policy effort to change course, I think that there will be a significant loss for Black businesses and consequently for the Black community.
And Dr. Ray, can I ask you the same question, but from the purview of the racial wealth gap? What do you think how could this impact that, when we know for a lot of Black families, this is their way of trying to close that gap?
I mean, it's devastating, to say the least. I mean, one thing people have to realize about the wealth gap nationally is that Black people have, or let me say it another way, whites have 10 times as much wealth as Black people. And as much as everyone talks about education being the great equalizer, it's very clear that it's not. When you compare Black people and white people who have graduated from college, Blacks still have 7 times less the amount of wealth that white people have. It's not about education. It's not about hard work. It's not even about financial literacy. It's about a legacy of one group being able to gain access to wealth and another not, and the continuation of that. See, oftentimes we talk about the legacy, we never talk about the continuation of it. And during COVID, we've seen it in a very, very detrimental way. And it's important to note who's probably most likely to be hit by this. One of the things that we know is over the past 20 years, Black-owned small businesses, along with Latino-owned small businesses, have grown at an exponential rate. But particularly Black women-owned small businesses have. And during COVID, a study out of Stanford that we cited in this report, that over 40% of Black small businesses have closed their doors during COVID. That was very early on. That was actually last year at the beginning of the fall. The other thing we know is, why is this? Again, it's not about financial mismanagement and all that sort of things. It's the fact that over 90% of Black small businesses nationally were cut out of payment protection program funding. And unfortunately, that continued in Detroit and the Tri-County area, where we did an analysis of who received the first kind of wave of that PPP funding. And we found that not only were small businesses in Detroit significantly less likely to receive PPP funding, but when they did receive it, they received less of it. And we're talking about 4 and 5 times less likely to receive it, and then being much less likely to receive less than $50,000. Over 75% of Detroit small businesses in that first wave received less than $50,000 compared to around 65% in the counties in the tri-state area, even including Altoone County. So this is something specific to Detroit. And what we have to ask ourselves is, be honest, is about who small businesses those are. As Jane said, not only is it about the small business owner, it's about the workers that work for those businesses that are in predominantly Black communities that are underserved, that are employing people who otherwise might find it difficult to get a living wage. So it completely highlights the racial wealth gap. And unfortunately, I think when we fully analyze the data and the impact of COVID, not only will we see that Black people have been less likely to lose, have been more likely to die, but we have also been more likely to lose wealth gains, similar to what happened during the Great Recession. Black people still haven't recovered from that about 12, 13 years ago. And COVID is going to be the same way, where whenever we make strides with racial progress, whenever we try to pull our own selves up from our bootstraps, not only are the chairs knocked from underneath us, but then when resources are allocated to make things equitable, they're not being made equitable at all. They're being made for one group over another group.
And so I kind of want to shift back toward the health impact, because one of the things that was honestly frustrating to me as a reporter, especially in the early days when it became clear that Black Americans were dying in disproportionate numbers, was how quick some folks in the media were to blame this on obesity or hypertension, these very specific health issues, right? When in fact, some folks are saying, well, these communities, they're more likely to live near incinerators. They're more likely to live in industrial areas that might make them more susceptible to gaining, to having asthma, or to the points that were made earlier about living in food deserts, right? If you can only get McDonald's, of course, these communities might be more likely to have weight issues, right? So can you both talk about the environmental issues that also kind of create challenges for these Black communities? I'm thinking about Flint with the lead issues, or even lead issues that are present in Detroit. So how has that played a role, if at all, in what we've seen?
To the extent, to the extent that environmental conditions impact our health, which they do, then we're seeing that. And when I talk about environmental conditions, I don't just mean, air, water, are you living, near some a toxic site or something like that, but it's also stress. I mean, stress is an environmental condition that's brought about by this myriad list of issues that the Black community is facing. And so, and it shows up, as we know, stress is not good for your health. It shows up in your health, and it creates a situation where you're more vulnerable for, when something like this pandemic, this virus comes along. And it's easy, and kind of the knee-jerk reaction is to blame the community for this. Oh, well, you wouldn't be dealing with this if you had taken better care of your health, because this is what's been done. You'd have a better job if you would get up and go to work, if you would do better in life. It just, putting the blame placing the blame on the Black community. But it's a complex mix of conditions, environmental conditions. Some are in the natural environment, some having to do with stress that really gave rise to these circumstances.
Yeah, I mean, without a doubt. It was interesting to hear some of the narratives early on, and that's one of the reasons why I applaud New Detroit and what's going on in Detroit in terms of saying, no, look, these structural conditions are there. We need to highlight it. And then we need to talk about what to do about it, because this is why it's important. If you're off in what the rationale is, or the primary explainers for the divide are, then you're going to be off in the policy solutions to address it. And part of the narrative, Kat, that you highlight is that it was an over individualization of why COVID was happening. It became kind of a blame the people who were disproportionately impacted, which was fascinating, because we have to remember that COVID, when it first started, people were trying to figure out what to make of it. Well, I know it's kind of hard for people to imagine, because like 14, 15 months ago, like it just seems like an eternity at this point. But early on, it was people who had a very high socioeconomic status were being hit by it. It was celebrities. Then it went into athletes. And then as a person who studies this, I was like, oh shoot, when it hits Black communities in urban areas, because they're densely populated, that's going to be a problem. Then when it hits rural areas that are Black and white and potentially lower income, that's going to be a problem as well. And that's exactly what has happened with COVID. So, I mean, as we talk about the explanation, I mean, what we have to do is to continue to recenter why we see these outcomes happening, and be very clear that when resources have been allocated, and I know we're about to talk about this, but it was kind of a colorblind approach that was taken to COVID. And there's a reason why this is important. There's a large report that we cited in our report that I think is one of the most telling things about where we are as a country, because COVID is something that is obviously hit everyone around the world. It's a pandemic. And there was a large study out of Hopkins that compared countries. How good is their healthcare system, and how prepared are they for a pandemic? And what the study found was that the United States ranked #1 in healthcare finances, but almost dead last in healthcare equality. That speaks to what America is. Sure, somebody can end up being rich, somebody can make a lot of money. But the question is, when we look on average, we see that Black people and lower income people are disproportionately hit. And in a city like Detroit, and then in a state like Michigan, where you can drive 5 miles and you go from a kind of an urban area to instantly being in a rural area, you can really see the drastic ways that a lack of healthcare access, coupled with these structural conditions, can disproportionately fall on people's bodies, particularly in a place like Detroit, right down the street from Flint, as you all mentioned, where we know that these environmental factors matter. I think this is the bottom line. Dr. David Williams, who's a sociologist at Harvard, studies public health, he always talks about how racism gets beneath the skin, like that stress that Jane was talking about, the way that systemic racism operate, it gets beneath our skin to impact, Kat, as you were saying, everything from what we have access to eat. It's a McDonald's on the corner, and I don't have a place where I can go to a Whole Foods or a Trader Joe's and buy some fancy fruit and juice. Instead, I'm stuck here getting this food that I know isn't good for me. And that especially hits hard if you're a family and you have $10 in your pocket. That's one of the things I used to tell people. If you're a family of 4, you got $10 in your pocket. Are you going to the McDonald's on the corner to feed everybody? Or are you going to go to the Whole Foods that doesn't exist? Because see, it's not even about whether or not you would go to Whole Foods. It's the fact that it's not even there to begin with. And I think these are the realities that when we take a colorblind approach to a pandemic, it just simply exacerbates existing racial and social inequalities.
Absolutely. You both have made such excellent points. So the last question that I want to ask before we transition into the Q&A from our audience is, we've really talked about how deep-rooted some of these issues are. So let's talk about solutions. Many communities have declared racism a public health crisis, but what comes next? And from both of you, what are the long-term policy recommendations that you both recommend based on the research you've done that will really ensure equity during this COVID-19 recovery period?
So I'll take a swing first. In terms of long-term solutions, it's a multi-pronged, multifaceted approach. There's, it's not one size fits all, because as we were discussing earlier, this isn't just a health problem. This isn't just a health access problem. It's housing. It's small business financing. It's education. It's all of the above. And so taking a look, and we identified some recommendations in the report, looking at each of those areas and identifying and putting in place the policies to support so that people don't find themselves in vulnerable positions in terms of their housing. The moratorium, as Rashawn mentioned, on evictions is great, but that's going to come to an end, and then what? And then there's a cliff for people. So we have to address that, all of those issues simultaneously. The issue, I think, is going to be the issue that has been political will. So it's not that we don't know what the problem is. It's not that there isn't enough data to understand what needs to happen and why we're here. But if the political will isn't there to accept the data that, you know, the Black community, for example, didn't bring this upon themselves by not eating right, then we're not going to get anywhere. So I think that's where the rubber meets the road. And that's where the greatest challenge is going to be, because there's a significant segment of the community, I mean, the community at large in the United States, that is opposed to this. And if we don't find a way around it, if we don't marshal the support to get past that group of people, then we're going to be right here. And we know, you know, what the reason for the opposition, and that's why we've got structural racism. And if we don't address that, if we don't get the political will to make the change, we're not anywhere. We know what we need to do.
Yeah. I mean, Jane summed it up well. I mean, at this point, I mean, look, we have the data. I mean, like some of the recommendations that we put into the report about collecting better data. And part of what we aim to articulate is how to use that data. That when we have the data, we also know which areas are hardest hit. So we can actually take a place-based approach, because we know, like in, say, the Tri-County area, just like most areas around the country, are segregated by race and class. So if you focus on the areas that have been hardest hit, and we know that in Detroit and the state of Michigan, I think that Michigan and Governor Gretchen Whitmer and what was going on in Detroit were out in front of this, right? Aiming to center racial equity, trying to get some mobile units out, aiming to center churches and community centers, which is one of our other big recommendations, that you have to put things in the local community, not only for access, but also to address a valid and rational mistrust of healthcare. Black people have many reasons to be distrustful of healthcare, and it's a valid response. So if you want to overcome that, center things in their community. It also helps to provide jobs and other sorts of resources that come along with putting things in those communities. And that political will that Jane talks about is so important, about taking a racial equity approach to the pandemic. And I think just a racial equity approach in general is perceived some sort of way that if you do that, that you're privileging one group over the other. And that's not what's happening at all. Instead, what we have to realize is that our existing policies automatically disadvantage one group compared to the other, and taking a racial equity approach can oftentimes center it to make things more equitable. Some of the other things that we also highlighted in the report around solutions is around workers and pay. I mean, look, people are, in the state of Michigan does better when it comes to the minimum wage than, say, certain states in the South and other parts of the Midwest, but it still hasn't kept on par with inflation. And we know that it's extremely difficult to make ends meet, that people are working multiple jobs, exposing themselves during a pandemic, despite this recent wave about unemployment benefits should expire because people can't find people for jobs. Well, you know what? Those jobs should be made safe for people. If a person is putting their life on the line during a pandemic, they should expect sick leave, and they should expect health insurance. And a lot of those jobs come with neither. So those are some of the recommendations that we thought were really, really important about what's going on, because right now, one of our other recommendations was about messaging, particularly social media messaging. It's just been completely off, to be honest with you. Like, it hasn't been really, really good. People are getting different messages about what's going on. And some of this starts at the top. And when I say the top, not necessarily in the state, but nationally. And you all both know this, Kat, you know this, covering what you cover, is these recent comments after Biden's congressional address were problematic, to say the least. I think they were confusing the people. So you set up and say that you experience racial discrimination, but then turn around and say that systemic racism doesn't really exist. Like, people are confused by that, and people know what their everyday reality is. And it's a slap in the face to Black people, particularly Black families. And as I reflect on Mother's Day yesterday, Black mothers who are out trying to do all they can to take care of their children, and people not wanting to admit the reality. This is the political will that Jane is talking about, that we must have at the state level and the federal level, as well as the local level in Detroit, even among Black people, to say, you know what, there are a lot of issues. And if we're going to get past this, we have to address them. Because again, this is why, as bad as COVID has been, researchers who examine these particular outcomes suggest that we could be here again, because the rate at which viruses are popping up is we might see something like this in the future. And this has been an example of what's going to happen if we don't address systemic racism.
Absolutely.
I just want to, just as a quick footnote to that, add that, again, the challenge is, if you are invested enough in your position and your unwillingness to acknowledge systemic racism, then you're willing to do almost anything. And we've seen that. We saw that through the pandemic. Now, it was obvious what needed, you need to wear a mask, wash your hands, stay out of crowded spaces. These things will help to keep the numbers down. You had people who refused because of information through the media and because it was not in they didn't perceive this to be in their political interest, who refused to do this. People who landed in the ICU who still did not want to believe that this was real. Now, how are you in the ICU and, you're angry with the nurses, you're denying this because you're not willing to acknowledge it, because to acknowledge it means you could be wrong in all these other areas. And some people are completely willing to go down with the ship if they can hang on to their beliefs and frankly, their white supremacy. That's what we have to deal with.
Yeah, great points. And so let's shift to the audience questions. There's some good ones coming in. So the first one is, as it relates to education, how has the COVID-19 response in Detroit affected access and enrollment in K through 12 in higher education? Or who wants to take a stab at that one?
Jane, you want to go, or you?
I'm sorry, could you repeat the question?
Sure. As it relates to education, how has the COVID-19 response in Detroit affected access and enrollment in K through 12 and higher education?
So I don't have any hard data, current data right now in terms of actual numbers in terms of enrollment. It's had a significant impact. I know in terms of attendance, that's been spotty. It's been due to a number of reasons, access in terms of technology. It's obviously much more challenging for some students to engage remotely than it is in person in the classroom. And so it has affected students' education in a number of ways, but I don't have the specific numbers in terms of how it's affected enrollment.
Well, Dr. Ray, could you speak also to maybe just the broader impact or implications that the pandemic has had on Detroit children or children in general?
Yeah, most definitely. I mean, one of the things that the Detroit has aimed to do is they really aim to push schools and learning centers to go back to 100% remote learning after spring break. We know that was a big deal because people had traveled, and then trying to get kids in school. This is the bottom line we see in Detroit and nationally, is that honestly, it's been all over the place. That different school districts and different schools have taken different actions, where some have tried to go full time, particularly if the classroom size is smaller. They've been able to do that. These tend to be more private schools, charter schools. Public schools, on the other hand, which have a lot of kids in each classroom to begin with, don't even have the space to do that. So instead, they've aimed to implement a hybrid model. And I think that's worked to a certain extent. But the other thing we have to bear in mind is that when people look at the number of cases at a school, which seems really low, which suggests on one hand that kids haven't been highly affected, but those that have been affected, and I think in some cases, there have been more kids that have had COVID than we know, they just potentially haven't been tested for it. So the bottom line is this: there is a resource issue in schools to try to create them safe, to help them to be safe in terms of spacing, in terms of testing when they come in. Schools have a big decision to make in the fall about whether or not they're going to mandate the vaccine. Of course, it's with children, it's going to be determined by the CDC and what they decide in terms of lowering the age. 12 to 15-year-olds are about to start qualifying nationally in terms of getting the vaccine. But the other thing we have to keep in mind is that there are teachers, staff members, administrators, janitorial staff, cafeteria workers who are at these schools who are being overexposed. And one thing we know in Detroit and the state of Michigan is the reason why that spike happened over the past month is because people got out. People started doing a lot of activities. And I get that people wanted to go out, but these were mostly activities at schools and in kids' programs that also exposed the parents, the staff, and the teachers. So moving forward, it becomes an issue in terms of aiming to address COVID in schools, because it's not simply about whether or not kids are testing positive. It's also about setting up an environment that's safe and ensuring that the staff can also be safe in schools.
And then and making sure the funding is there to make this happen, because that's the educational funding, the way that it's done is a contributing factor to this as well.
Yes, and before I cap to the next question, I would just like to point out one thing that I've thought a lot about is a lot of these children have lost parents, caregivers, loved ones, and I just don't think we can fully understand that impact yet, to lose a parent in the midst of the pandemic, and also the economic earnings as well. So the second question, I actually really love this question. What have been the strengths, attributes exhibited in our community during the pandemic that kind of gets at the resilience? Jane, do you want to take that one?
Well, yeah, sure, I'll start. So I think the strengths and the attributes and the resilience, I mean, have always been there. It's Detroit, it's the Black community, this isn't the first time that Detroit and the Black communities has had to show resilience and strengths and pull together, and that this wasn't an exception. This was an exceptional time, but to the extent possible, I think that the community rose to the challenge. Neighbors helping each other, churches stepping up to the plate as they usually do under these circumstances, and providing food for the community. Nonprofit organizations also pitching in and doing more than their share of work, people volunteering to help them as well. Funders even pivoting along with the nonprofit organizations to provide the support to allow this to happen. And so I think everyone really stepped up to do their part. It was just such an overwhelming burden. It was really tough to keep up with.
I agree. And even in a sense of kind of like a mutual aid network that I saw kind of emerge with neighbors taking care of other neighbors. And Detroit, in my opinion, has always felt like a big city, but it also kind of has that Southern feel where everyone will just, we have each other's backs. And I just think that has been one of the most beautiful things, if anything, can be beautiful to emerge of this moment. Dr. Ray, could I ask you this next question? Is there a correlation between education and the fact that Black-owned businesses received little, if any, PPP?
Not as much as people would think. So I think embedded in that question, which is an important point, is whether or not it's related to some sort of financial literacy or knowledge that people have about banking and the finance structure. And what we show is that not really. And it's a couple of reasons to point out there. The first has to do with with who are small business owners to begin with. If we look in the whites community, it's a lot of small business owners who aren't highly educated. That hasn't stopped them from being able to gain access to capital and grow their businesses. The second thing we know, which is a more important point, is where banks are located and who actually gets access to that capital. See, one of the things that the PPP funding and the racial disparity there and the difference between Detroiters and others in the Tri-County area, what that reveals is just what happens on a normal basis, like you all have highlighted already, which is where we know Black small business owners, similar to Black people just trying to go buy a home or get a vehicle, are less likely to get a loan, even when they look good on paper. They are also then less likely to get the same amount of money, even when they can qualify for a loan. And then we know that their interest rate is higher. And as my colleague Andre Perry at Brookings always says, he says, embedded in the assumption is some kind of way that the Black business isn't as good enough, right? That the Black restaurant or the Black financial firm or, you know, this other Black organization is some kind of way they aren't good enough. And he would always say, but our ice is just as cold, making the statement that, look, it is what it is. And in fact, some of his analysis is found, if you look objectively at Yelp reviews, not saying that they're completely the end all be all, but assuming that people patronize businesses, Black small businesses actually get rated higher than non-Black businesses, but they actually get less access to capital. So, you know, it's not so much about education or literacy. I mean, we see, particularly among Black women, that the group that's starting up small businesses are highly educated. The problem is their access to capital to make their companies successful. And that becomes one of the biggest issues that we see when it comes to finances.
Jane, did you want to add anything to that?
No, I was just going to echo what Rashawn said, and by saying that yes, relationships are critical. And so if you don't have those relationships, then it was, you know, too difficult for many Black small businesses to get in and get a loan. And perception, as Rashawn had indicated too. So you can show up, you can look good on paper, but if there's a perception there that your business is more vulnerable, even if you look the same as another business that just qualified for a loan, you're not going to get it, or you're going to get a smaller amount, a higher interest rate, and so on. And we've just seen this play out just across the board.
So this next question is kind of a two-part one. So bear with me as I read it. So this person said, I often say that we have to center the question, what determines the social and economic determinants of health, overlaid with an analysis of the spatial structural racism to understand COVID. What role is there for a health in all policies moving forward?
Well, I mean, one of our main recommendations was to ensure that racially equitable healthcare access occurs. So part of what I hear embedded in that question is about how we think about healthcare access and how we think about healthcare coverage. And one of the things we know, and it also kind of speaks to a question in the chat about partisan politics, but we know that the Affordable Care Act under the Obama-Biden administration had one of the biggest impacts in a positive way in addressing racial health disparities. That more Black people, more Latinos were able to get covered in ways that they were not previously. But interestingly, one thing that research highlights, and I love studies that do this, even though the outcome can be a bit depressing. They gave people the same script, which is what the Affordable Care Act is. But at the heading of one, it said Affordable Care Act, and then the other one, it said Obamacare. And what they found was that overwhelmingly, people, particularly Republicans who were very conservative, were less likely to support the policy when it said Obamacare and more likely to support it when it said the Affordable Care Act, because the Affordable Care Act has also helped rural, lower income white people, which we know in a state like Michigan, that there are many pockets around the state that looks like that. So part of thinking through this is that, look, healthcare coverage and healthcare for all is important. And I think it really starts with workers, particularly these frontline new essential workers that are putting their lives on the line every day for some of us to be able to order Instacart and have brownies show up at our door, or have food delivered to our house from our favorite restaurant because we didn't want to go out and wanted to pay a little surcharge, or the time where something needed to happen and we needed a package delivered, like you've cranked that up during COVID, where you're just able to go online and do that. And then we have to think about who the people are who are making these deliveries, not only in terms of their social class, but also in terms of their race. So thinking about racial health equity, and this is why the economy is so important, because most people get their health insurance coverage through work. And in our report, we found that Detroiters, compared to others in the tri-state area, including out of Detroit in Wayne County, Detroiters were much less likely to have health insurance coverage. So we talk about coverage, we talk about access, and then we talk about equity once they get to the hospital, because we know nationally that early on during COVID, Black people were 6 times more likely to be turned away from COVID-19 testing and treatment. Right down the road in St. Louis and Indianapolis and other places, we saw that playing out in a detrimental way, where a physician died in the hospital because they didn't believe her about her pain level, and a man sat in the parking lot after he had been turned away for the 3rd time and died. And we know in Detroit and in Michigan, there are some of these stories as well. So part of thinking through this and centering racial health equity is addressing where these gaps are and then implementing policy to do something about it. And more importantly, I think oftentimes it's holding people accountable when they actually exhibit the bias that we're talking about, whether that be at a hospital or at a bank.
Absolutely. And I would love to, since we only have a couple minutes left, just offer each of you the chance to give closing comments or 1-minute closing statement. Jane, let's start with you.
Well, I just want to say thank you again for the opportunity to come and to participate in this. It was an excellent opportunity partnering with Brookings Institution on this, and having a chance to, kind of shine a light on a lot of the issues around COVID and everything that is kicked up as a result of that, so that helping people to understand that the focus is much broader than a public health issue, that it touches everything that you can think of: housing, education, all the areas that we discussed earlier. And it's going to take everyone's input, support, advocacy in order to bring about the kind of change that needs to take place to address these underlying racial disparities, so that, please, let's not do this again.
Yeah, I mean, that's it. Look, I mean, the racial gap in COVID diagnosis and deaths is not just disproportionately killing Black people, but literally killing off Black communities. And what we try to do in this report is to highlight the comprehensive ways that it plays out. And we were very deliberate about approaching it that way. And so, I mean, I just want to thank New Detroit. I want to thank JFM Consulting and Data-Driven Detroit, and our colleagues at University of Michigan. And then my colleagues at Brookings, Samantha Elizado and Destiny Wiley-Yancey. And then, of course, Lydia Wilden from Michigan, from University of Michigan, who worked with us on this project. And thanks to you, Kat, for moderating this, because this is an important discussion. And the report, I hope people really read, because I think Detroit, and Jane said this at the outset, is really an exemplar in terms of highlighting what is happening across the country. And the way I think about Detroit, and I spent some time at University of Michigan, I spent 2 summers there, I spent a lot of time in Detroit, that Detroit becomes emblematic of what is happening around the country. So focusing on Detroit and addressing what's happening in Detroit, if we can deal with it there, then we can deal with it in other parts around the country as well.
Absolutely. And thank you both for joining us. This has been a very important conversation. And thank you, New Detroit, for having all 3 of us on to talk about what I said is such a crucial issue now, and will continue to be so in the near future. I know that New Detroit has 2 additional town halls, so be sure to keep an eye out for those. And thank you so much for joining us this afternoon. Take care, everyone.
Thanks. Yep.